Over 20 years? Over 20 years, breast cancer has gone through an entire revolution. I mean, this is where we started having aromatase inhibitors. Maybe just we're at the tail end of that 20 years. So we had aromatase inhibitors in the metastatic setting, but for early stage, it's within that time frame. HER2 positive therapy with trastuzumab started 20 years ago, and then within the 20 years, we saw that we could change survival by giving trastuzumab to patients with early stage breast cancer, and that we could sometimes have patients have long-term survival at metastatic disease with trastuzumab. And of course, all of the add-on drugs since then, which have continued to improve survival for patients with HER2-positive disease. In the hormone arena, we move on from aromatase inhibitors to fulvestrant, to better dosing and scheduling of fulvestrant, which worked better, to understanding that some patients might actually benefit more from fulvestrant than from aromatase inhibitors, and from this very, very exciting field of targeted agents with first the mTOR inhibitor everolimus, the explosion of CDK4/6 inhibitors, and now the PI3 kinase inhibitor, the alpha-specific PI3 kinase inhibitor alpelisib. And then more recently, really an explosion in understanding immunotherapy for triple-negative breast cancer and expanding that to other disease subtypes and trying to understand how we can best use this disease. And the other thing we've learned in the last 20 years is that people who get a pathologic complete response from neoadjuvant therapy have a very good chance of being cured of their cancer, and that we can give people prognosis and potentially better therapy by treating them in the neoadjuvant setting. Patients who have more proliferative ER-positive disease, HER2-positive and triple-negative breast cancer. And now, more recently, we've learned that people who didn't get a pathologic complete response, we can alter their outcome by giving them other therapies. And that's very recent data, which further, I think, strengthens the role of giving treatment in the neoadjuvant setting. And then I think really lastly, the last 20 years have brought a big explosion in supportive care as well. And we've been able to offer supportive care to patients that we didn't have before. I mean, it's amazing to think that really growth factors and the widespread use of growth factors, the use of dose-dense chemotherapy, all of that has been largely in the last 20 years, a long-acting myeloid growth factor, pegfilgrastim, the rise and fall of erythroid growth factors, for example. And then more recently, scalp cooling, an area I've been quite passionate about. That's an area of choice, and being able to prevent mouth sores from everolimus with the steroid mouthwash. All of this, studies that have looked at ways to prevent hot flashes with a lot of different agents, really date back about 20 years.